Finger on finger fulcrum. What it is sometimes you may need extra fulcrum place if there's no teeth, missing teeth, things like that. You can actually build your own finger as your fulcrum place. So I use my left hand index finger and then fulcrum on my finger, and then this way actually instead of using the vertical strokes, you're gonna be using horizontal strokes. I'm having 11-12 Gracie to do this mesial of canine right now, fulcruming on off of my finger, horizontal stroke, directly insert this instruments into interproximal. So it's a horizontal stroke, so you're gonna pull towards you and scale this mesial surface. You can also do premolar here to do mesial surface, horizontal strokes. Key to horizontal strokes is handle is always parallel to the occlusal plane. So this is finger on finger fulcrum. You can also do mandible too. I'm gonna move my finger on the mandible, okay? And then you can actually fulcrum off of your finger. This is again mesial side to do it with your Gracie 11-12. Horizontal strokes like this, horizontal stroke like this. Very short strokes, because if you're not careful, you could cut your finger. So very carefully scale if you're using finger on finger. But this is some alternative when you don't have no place to fulcrum or having hard time getting into the interproximal area.
With the cross-arch fulcrum, we're going to be initially placing the instrument against the side of the tooth before we determine our fulcrum. So we're going to adapt the instrument blade against the side of the tooth with the correct angulation, then place our hand down on the crossing the midline in order to get good angulation, access, and parallelism. Initially starting with our exploratory stroke to determine the depth of pocket as well as the amount of calculus present. Then we incorporate our calculus removal stroke. Notice the index finger, how the first knuckle is flat. You will also notice the wrist activation motion. This is a very powerful stroke and can access deep pockets on the distal surfaces of posterior dentition.
Okay, now I'm going to demonstrate maxillary arch fulcrum reaching down for mandibular right posterior buccal surface. So usually you're going to scale right here interoral fulcrum. That's the easiest way to fulcrum. But when you have a heavy duty calculus cannot get, you may need more power. You can fulcrum top of that tooth you're working on, usually from the mesial of first molar all the way to the premolar. Fulcrum right here interorally or extraorally, zygoma, and then sitting at the 3 o'clock position. Then you're gonna scale mesial surface like this from top down. So your thumb is on top of the surface you're working on. So it's direct lateral pressure is coming from the thumb. You can come this way, all the way, and then even continue all the way anterior teeth. I'm gonna reinforce with your other finger. That will gain my double the power here and control too. So you can scale mesial this way, enough up and down vertical strokes. You can also use this technique for the lingual of lower left. I'm going to demonstrate maxillary anterior teeth scaling by doing extraoral fulcrum today. Today, you have been taught to intraoral fulcrum and scale like this before. Okay, something like this. However, this is going to limit the access and pressure, power. So you can actually extend your fulcrum away from the internal incisal edge and then do the mandibular arch. It's called extraoral fulcrum. Extend your instruments and then start scaling like this. You may feel like you lose control. Then you can use actually reinforcement. You can add your finger to add more control. But by doing this, you can gain more power and depth with scaling. Okay, this is 5-6 Gracie. However, now I'm going to demonstrate something funky using 11-12 Gracie. 11-12 was known as mesial instrument. However, you can now use it for anterior teeth. You can start from right angle here, surface away, fulcrum, and then see, it's just like mesial. Continuation of mesial scaling can be done for surfaces away for maxillary anterior teeth. Okay? All right?
The Gracie curette, the maxillary arch, left posterior, buccal aspect, mesial surfaces. For the conventional technique, we will be using a palm up and retracting with the mirror, vertical strokes down. For the reinforced technique, we will be using an extraoral fulcrum with the back of the hands resting against the patient's jaw and chin. We're going to take the left forefinger, position in the vestibule, retracting the patient's left cheek, while the remaining fingers rest on the patient's cheek. The left thumb to the right thumb, bridging for reinforcement. Vertical pull strokes using both hands while utilizing the hands and the arms as a single unit to obtain additional stroke power, lateral pressure, and stability. This will all be with the operator position between 8 and 9. The additional reinforcements are with the index finger on the shank, the extraoral fulcrum, the back of the left forefinger gently retracts the patient's cheek while applying pressure on the instrument shank. The left thumb fulcrums intraoral on the anterior teeth, while the remaining fingers rest on the patient's cheek. We may also use the pinching shank technique. The extraoral fulcrum, the left forefinger and thumb pinch the shank for additional reinforcement and control. Now I'm going to be using the Gracie curette, the 7/8. The conventional technique is to retract the cheek with the mirror, use a modified pin grasp with an oblique stroke. The reinforced technique, you will use the working hand as the extraoral fulcrum with the fingers supported against the patient's jaw and chin. The reinforced hand will have the left forefinger positioned in the vestibule, retracting the patient's left cheek, while the remaining fingers rest on the patient's cheek. The left thumb to the right thumb for bridging. for reinforcement. The technique will be an overlapping, oblique stroke, pull stroke using both hands and arms as a single unit to obtain the stroke power, pressure, and stability. Additional reinforcements will include the index finger on the shank, the extraoral fulcrum. The back of the forefinger gently retracts the patient's cheek while applying pressure on the instrument shank. The left thumb to the right thumb bridging. We can use the pinching shank technique where the extraoral fulcrum has the left forefinger and thumb pinching the shank for additional reinforcement and control. Now I'm going to be doing the maxillary arch, the left posterior from the buccal aspect, the distal surfaces with the Gracie Curette 1314. The conventional technique is using the mirror for the indirect vision and resting the working hand up against the mandibular arch. For the reinforced technique, we're going to have an extraoral fulcrum with the fingers supported against the jaw and the chin. The reinforced hand will have the left forefinger positioned in the vestibule, retracting the patient's left cheek, while the remaining fingers rest on the patient's cheek. We'll be doing the left thumb to the right thumb, bridging for reinforcement, and a vertical pull stroke with both hands and arms as a unit to obtain additional power, pressure, and stability. Additional reinforcements, we will use the pinching shank, extraoral fulcrum with the left forefinger and thumb pinch the shank up by the handle for additional reinforcement and control. We can also use the index finger on the shank. We can have the extraoral fulcrum, the back of the left forefinger gently retracts the patient's cheek while applying pressure on the instrument shank. The left thumb fulcrums intraorally on the anterior teeth while the remaining fingers rest on the patient's cheek. Now I'm going to be doing the maxillary arch, left posterior from the lingual aspect, the mesial surfaces. I'll be using the Gracie Curette, the 1112. The conventional technique is using the mirror to retract the tongue if needed, and a palm up, completely vertical stroke. The reinforced techniques include having the working hand have the extraoral fulcrum palm up with the back of the fingers rest against the patient's jaw and chin. The reinforced hand will take the left forefinger, gently retract the patient's cheek, and depresses the tongue if needed. The index finger will be on the shank, the part of the shank that is closest to the handle. The left thumb and will go to the right thumb, bridging for reinforcement, using a vertical pull stroke with both the hand and the arm as a single unit to obtain additional power, pressure, and stability. Additional reinforcements, we can do the pinching technique. It's an extraoral fulcrum where the left forefinger gently retracts the cheek while pinching the instrument with the thumb. The back of the hand and the remaining back of the fingers rest against the patient's cheek and jaw for support. The index finger can be placed right on the shank in the front of it. We'll have the left forefinger gently retracting the cheek while applying pressure on the instrument shank. The left thumb to the right thumb for bridging. Now I'm going to be working on the maxillary arch, the left posterior lingual aspect, the straight lingual surfaces. I'll be using the Gracie Curette 7/8. The conventional technique is to be cupping the chin and retracting the tongue with the mirror, using an oblique stroke on the direct lingual surfaces. The reinforced technique, in the left forefinger gently retracting the left side of the patient's cheek and depressing the tongue at the same time while the remaining backs of the fingers are bent and supporting the patient's cheek and jaw. The left thumb will go to the right thumb, bridging for reinforcement. We'll use an overlapping oblique stroke using both hands and arms as a unit to obtain additional power, pressure, and stability. For additional reinforcements, we can use the pinching shank technique. The extraoral fulcrum, the left forefinger gently retracts the cheek while pinching the instrument with the thumb and the index fingers. Use the back of the hand, and the remaining back of fingers will resting against the patient's cheek and jaw for support. We can also place the index finger on the shank. We'll have an extraoral fulcrum with the left forefinger gently retracting the right cheek while applying pressure on the instrument shank. The left thumb to the right thumb, bridging. We'll be doing the maxillary arch, the left posterior lingual aspect, the distal surfaces. I'm going to be using the Gracie Curette 1314. The conventional technique is to take the mirror and retract the tongue if needed. Use a palm up vertical stroke, modified pen grasp. The reinforced technique, we will take the left forefinger gently retracting the patient's right side of the cheek, depressing the tongue if needed. At the same time, the back of the fingers are bent and supported on the patient's cheek and jaw. The left thumb to the right thumb, bridging for reinforcement. Vertical pull stroke. Both hands as a single unit to obtain additional power, pressure, and stability. For additional reinforcements, we can take the index finger, put it behind the shank, have an extraoral fulcrum with the left forefinger gently retracting the right cheek while supporting the back of the shank. The left thumb to the right thumb, bridging. We can also use the pinching shank technique. The extraoral fulcrum will have the left forefinger gently retracting the right cheek while pinching the instrument with the thumb. The back of the hand and the remaining back of the fingers rest against the patient's cheek and jaw for support. Now we're going to be doing the mandibular arch, the right posterior from the buccal aspect, the mesial surfaces. I'm going to be using the Gracie Curette 1112. The operator position for this technique is between 12 and 2 o'clock. The conventional technique, we will be just using a completely vertical stroke. The reinforced technique includes the left forefinger retracting the lip and resting in the vestibule, with the remaining fingers cupping the chin and jaw for stability. The left thumb goes to the right thumb, bridging for reinforcement. We can also use additional reinforcements and put the index finger on the shank with a completely vertical pull stroke. Now I'm going to be doing the mandibular arch, the right posterior buccal aspect, straight buckles. I'm going to be using the Gracie Curette 7-8. Operator position is between 8 and 9 o'clock. The conventional technique will be fulcruming cross arch with an oblique stroke. The reinforced technique includes the left forefinger gently retracting the right cheek while the remaining back side of the fingers resting against the patient's cheek and jaw. The left thumb will go to the right thumb, bridging for reinforcement. Additional reinforcements include the thumb on the shank. Now I'm going to be scaling the mandibular arch, right posterior, buccal aspect, distal surfaces. I'll be using the Gracie Curette 13-14. The conventional technique will be sitting at 8 to 9 o'clock, retracting the patient's lip with the mirror, modified pen grasp, straight vertical stroke. The reinforced technique will still be sitting at 8 to 9 o'clock. The working hand has an intraoral fulcrum on the mandibular anteriors or bicuspids. A built-up fulcrum may be necessary for a parallel shank. The left forefinger gently retracts the patient's cheek, while the remaining finger and hand rest against the patient's cheek and jaw. The left thumb goes to the right thumb, bridging for reinforcement. We'll use a vertical pull stroke, using both hands and arms as a single unit to obtain additional power, pressure, and stability. Additional reinforcements include the index finger on the shank. The left forefinger gently retracts the patient's cheek and applies pressure on the shank part closest to the handle. This is the mandibular arch, right posterior, buccal aspect, distal surfaces. I'm going to be using the Gracie Curette 13-14. The conventional technique is with the mirror retracting the lip, fulcruming on the anterior teeth, modified pen grasp, straight vertical stroke. The reinforced technique includes the operator position at 8 to 9 o'clock. The working hand has the intraoral fulcrum on the mandibular anteriors or bicuspids. The reinforced hand, we have the left forefinger gently retracting the patient's cheek while the remaining fingers and hand rest against the patient's cheek and jaw. The left thumb goes to the right thumb for bridging and for reinforcement. And then we have the vertical stroke pulling up. Additional reinforcements include the index finger on the shank, the part of the shank that is closest to the handle, the intraoral fulcrum. The left forefinger gently retracts the patient's cheek and applies pressure.
Wondered when you sharpen if how you're doing it is effective. This is a little trick to help you check and make sure your angles are correct. So grab a Sharpie and fill in the entire lateral side of the cutting edge. So on your Gracies, it's gonna just be one side. On your Sickles or your Barnhart or whatever, it's gonna be both. Just gonna completely color in the lateral surface. Next, you sharpen your instrument with your regular stone. By the end of your regular sharpening, the mark should completely be gone from the lateral surface of the instrument. If not, it's probably because your 70-degree angle might be a little bit off. So you need to just adjust your angle so you're completely sharpening the heel, middle, and toe of your instrument.